there's really three distinct pieces. There's Premier Dermatology, which is the medical side of the practice, where we will do skin cancer, we'll do rashes, we'll take care of acne and warts, and we'll do all of that on the medical side. And then there's the Skin Renewal Center, which we've had for years, which is basically our aesthetic branch. And it's where I will do most of the injectables, like Sculptra and Juvederm, Restylane, Radiesse, and all of those phenomenal products that we've been offering. Botox, of course. And Kara will also be doing that, like she always has, our fabulous physician's assistant. And so there will be that portion of the Skin Renewal Center. And then Nellie, our certified laser technician, who is also a nurse, will be running the lasers. Multiple different laser treatments that we will have: laser hair removal, IPL, Fraxel, the non-invasive version of Fraxel that Nellie is also now running, Limelight, all kinds of wonderful laser treatments that will be offered again and still through the Skin Renewal Center. And then there's the new fusion that Helena and I have come up with, and it's going to be East meets West at Premier, and that's going to be our spa. And we are going to offer spa services like you can't find anywhere else really in the country. It's going to be a phenomenal fusion. Well, on the medical side of Premier Dermatology, it's the same great patient care that we've always offered. We definitely want patients to realize that. But we are adding some things to the practice that I think are going to make the experience here extraordinary. First of all, we're going to be taking over as Dr. Ubben. He's a colleague of ours in Bella Vista. He's going to be backing down and going toward retirement over the next year or so. And so we're going to be accepting patients from his practice and kind of seeing patients at his practice as he's kind of evening out and kind of retiring. So that's one thing that's going to be really exciting coming up. Also, we have another dermatopathologist, which is a skin pathologist. Basically, if I take a biopsy of your skin, we put that little sample on a slide and a pathologist reads it to tell us what the diagnosis is, whether it's a skin cancer or a certain rash. And so what this dermatopathologist is going to do is she's going to join us as a member of the team, so that immediately when we do a biopsy, there will be someone in-house that can tell you exactly what the diagnosis is. And so there'll be very little turnaround. The specimen will never leave our clinic. So you'll know results immediately. And that's just a really nice thing for patients, because there's never going to be any question about who handled their specimen. Is it someone that's qualified? And she is a board certified dermatopathologist, which means in addition to being a regular pathologist, she spent extra time and has actually passed a board certifying exam to read skin only pathology. So that's a very exciting addition to the practice. And then finally, we have another dermatologist who will be coming in about a year. Her name is Dr. Katie Allen. She, in addition to being a dermatologist, is a board-certified Mohs surgeon, which means that she does specialty skin cancer surgery that only Mohs surgeons are qualified to do. In addition to a dermatology residency, she spent extra years training to do this procedure where you take off the skin cancer in layers. And immediately while the patient is still there in the clinic, she can look at it and determine whether the cancer is completely out. And if it's not, you can go back and take tiny pieces. What this does for the patient is, instead of taking a very large excision with extra margins of normal tissue, it allows us to only take what needs to be taken, but it also gives us that close to 100% cure rate that we're looking for. So we hope that with all of us coming together in this one practice, we're going to provide world-class dermatology care that you really can't get anywhere else. I think with Dr. Mills, our dermatopathologist, coming in, Dr. Allen coming in, Dr. Allen at Mayo in Rochester, she's used to that kind of collaborative care of patients. When you go to Mayo, you see everyone in the group. And that's what I think we're going to be able to offer, is now we're going to have lots of very smart people really working together to provide the very best care so that patients really don't have to leave the region for dermatology. I had someone tell me the other day, you know, it's interesting because women trust women and men trust women. So to a large degree, I think there is a lot of trust factor, and I think our patients over the years have realized that I'm going to treat them just like they're a member of my family, and I know these other two ladies will do the exact same. They're just the nicest, most down-to-earth people, in addition to being exceptionally smart people. So I don't think the experience is going to change, except that it's just going to be better. All going to be in-house. Everything from the moment you walk in the door to getting checked in, you're all going to be very efficiently taken to a place where things get done, and things get done very efficiently and very accurately. So it's all laid out in our new building by the space planner. We actually had a medical space planner come in and set up the exam spaces so that you don't have to try to figure out where to go and where to check in and where to check out. So it's going to make the flow very nice. It's going to make us much more efficient because all of our nurses are going to be right there together, and it's just going to make the flow really nice throughout the practice. The facilities are going to be world class. We're going to have in-house labs where we process our own slides. We're going to have in-house surgery units and surgery areas where we do the more specialized surgery. So it's just going to make things so much more seamless. Our number one goal has always been, and I think all of my patients know, that I never want to just do the cosmetic side of the practice. The medical side is what I fell in love with years ago. Taking care of my medical patients is always right up there at the very top of my priority list. And so that's not ever going to change. It's going to be in a much more beautiful facility, certainly, but it's going to be very comfortable. It's not going to be super feminine in any way. It is just going to be a lot more efficient. So I don't think the patients as they come in are going to feel like that the cosmetic side is taking precedence, because really you're not even going to see the cosmetic side of the practice unless you specifically come for that. So in the medical side, you're going to just come in and see me in the exam room or one of my colleagues in the exam room like you always do. So there's not going to be more of a push on the cosmetic side of things. As far as skin cancer goes, there's the basal cells and squamous cells, which are very, very common types of skin cancer. And then there's melanoma, which is really the most life-threatening type of skin cancer. And so all of us are going to be focused on finding and detecting those early and getting those taken care of. And if you don't have that expertise and that background, you're not going to recognize those cancers early, and they can be disfiguring or they can actually be life-threatening. And so other physicians, nothing wrong with my colleagues. I have brilliant colleagues in family medicine, have brilliant colleagues in plastic surgery all around the region. But really no one in their training has the type of background that a dermatologist has. We spend 4 additional years outside of medical school learning nothing but how to diagnose and treat skin conditions and skin cancer. I really, really love my patients, and I really, really love my job. I hope that everybody gets that when they come to the clinic. But never do I wake up and think I don't want to go to work. And there are times, even when I've had a long weekend, I'm ready to come back to work. I love my kids and I love my family more than anything in the world. But I love my job, and I don't think I would be a very good mom if I didn't have my job. Just like I don't think I would be a very good doctor if I didn't have my family. So I think both sides of my life really complement each other really well.